Well, welcome to another video in the Campbell teaching series. As usual, there's no music, nothing fancy. This is just a serious thing for people who want to learn seriously with the aim of helping people. Today we're continuing the medical terminology series because it's important that we can express ourselves clearly and understand others precisely when they communicate with us. And today we're looking at things related to the blood, terminology related to blood. Now, as seems to be the convention in these talks on terminology, the word at the start, the prefix, I have coloured in red. And later when we look at suffixes on the end of the word, they'll be in blue. And of course, when you think about blood, the first word that comes to mind is heme. Heme means to do with the blood. So H-A-E-M in English, H-E-M in American English. The rest of the spellings of the word are the same, it's just that in the American English they don't put in the A. So haematology, ology, as you probably know, is the study of. So haematology is the study of blood, and a doctor who specialises in the study of blood would be a haematologist. Now, hemopoiesis. Hemo, of course, means to do with the blood. And poiesis means to create, to bring into being. It's Greek. So hemopoiesis is the formation of blood within the bone marrow. Now, hemorrhage means bleeding, whether that bleeding is external or whether it is internal within the body. So the heme is blood. Now, the regia part is Greek, and it actually means an excessive flow, or to burst forth. So the regia is describing a flowing action. And that implies in the Greek that it's a major hemorrhage, of course, but in modern terms we use the word hemorrhage to describe major and minor hemorrhages. So really it just means a flow of blood. And blood is leaking out of the intravascular compartment into somewhere else where it shouldn't be. Now, if blood leaks out of a blood vessel or leaks out of the heart and it can't escape to the outside of the body, it can't be external hemorrhage, then it's going to collect in the body tissues and we're going to get a pool of blood within the body tissues. That is a hematoma. So oma, again from the Greek, it means a lump, a swelling or a tumour. So it's a collection of blood that has already bled from the intravascular compartment. And this could be anywhere. For example, if a blood vessel is not properly ligated in surgery, it could bleed and a hematoma could collect. Or after a head injury, there could be a collection of blood underneath the dura mater, a so-called subdural hematoma. Now, haemophilia is an interesting word, and to tell you the truth, I'm a bit stuck on this one, because heme means blood, and philia actually means love, as in Philadelphia, the city of love. Because what haemophilia actually is a blood clotting disorder. For genetic reasons, the body doesn't produce one of the essential clotting factors called factor VIII. The coding for this is on the X chromosome. It's an X-linked characteristic. Typically, women carry it and boys suffer from it. And if it's a life-threatening bleeding disorder. So why it should be called blood love, I'm not quite sure, but it's what we're stuck with. But that's what it is. It's the bleeding disorder, haemophilia. Hematuria means blood in the urine. So whenever urea is on the end of the word as the suffix, that means in the urine. Now in health, urine contains no blood whatsoever. So hematuria, if we find blood in the urine, whether it's so-called frank blood that we can see, or whether it's occult hidden blood that we detect only with our dipsticks or some other pathological testing, regardless of that, the blood in the urine, whether it's microblood, occult blood, frank blood, is always a pathological finding and should always be explained to explain where that blood is coming from. Hemoglobinopathy. Well, heme is to do with blood, and globin describes globular proteins. And actually the hemoglobin is the iron-based protein in the blood that carries the oxygen. It has a high affinity for oxygen, and the oxygen will absorb onto the hemoglobin in the lungs, forming oxyhemoglobin. Pathy as a suffix, of course, means disease of. So hemoglobinopathy is disease of the hemoglobin. So, for example, there's a genetic condition called sickle cell disease, where the hemoglobin is abnormal, and this means that the red cells change from the normal biconcave discs to being sickle-shaped, like quarter moon-shaped cells. Or thalassemia can be a hemoglobinopathy as well, where there's a problem with the structure of the hemoglobin. And often these conditions result in hemolytic anemia, as the reticular endothelial, the macrophage monocyte system, break down the abnormal red cells containing the abnormal hemoglobin. Thorax is originally from the Greek. It was a piece of armour, the breastplate. But thorax has come to simply mean the chest. So hemothorax is blood in the chest. And specifically, hemothorax is blood that collects between the visceral and the parietal peritoneal membranes, almost always as a result of trauma. And it's one of these onto the floor and four more things we remember for hemorrhage. So in hemorrhage, blood can be lost onto the floor or into the thoracic cavity, into the abdominal cavity, into the pelvic cavity, or into the long bones. They are the potential sites of major hemorrhage, onto the floor and four more. So bleeding into the space between the pleural membranes, the potential pleural space, hemothorax, is one of those four, and it is a potentially life-threatening hemorrhage. And it's life-threatening not so much because it will reduce lung volumes, although it will reduce lung volumes, it will compress the lung to some extent, but it's life-threatening because of the sheer volume of blood that can be lost into that space. It's one of the so-called third spaces where body fluids, in this case blood, can accumulate. Now, emia is spelled A-E-M-I-A in English and E-M-I-A in American English, but it's exactly the same word. And emia means present in the blood or a condition of the blood. And the Greek emia became hema in Latin. So heme is Latin, emia is Greek. That's why we have the two words. So the first word we see there, anemia. So the prefix an actually means without. So anemia means literally without blood. In actual fact, anemia is a reduced oxygen carrying capacity of the blood, often associated with a low hemoglobin level. So there's clearly many examples of the suffix emia. Just got a few here. Bacteremia would be the presence of bacteria in the blood, generating a systemic infection. Polycythemia. So the poly means many, and the cy means to do with cells, as we'll actually see in a later slide. So in polycythemia, there are too many red cells in the blood. Many cells blood, polycythemia. Hypoalbuminemia, hypo low. Albumin is the most common protein in the blood plasma, and emia again in the blood. So low levels of the protein albumin in the blood, hypoalbuminemia. I'll just tell you about this interesting photo I've inserted here actually. This is a patient who reported with severe iron deficiency anemia. And you can see that the iron deficient cells are the small ones. They're microcytic, the cells are small, and they're hypochromic, they're very pale in colour. But the newer cells, the larger, darker coloured cells, these are the ones where the bone marrow had sufficient iron to produce the cells normally. So it's what you call a diamorphic field. It's halfway through treatment. because remember that the red cells last for about 120 days in the circulatory system. So there we see the difference between the normal red cells and the severe iron deficiency red cells after 6 weeks of treatment. And in another 6 weeks of treatment, we'd expect all the cells to be the nice, larger, darker coloured, healthy cells. Just a few more examples of emia on the end of the word as a suffix. Hyperglycemia, hyper, high. The gly in the middle relates to glucose, so hyperglycemia are high levels of glucose in the blood. Hypoglycemia is the converse of that, low levels of glucose in the blood. And thalassemia is a genetic disease which affects hemoglobin synthesis. Now, the interesting diagram on the right shows what we get if we get a blood sample and anticoagulate it with something like heparin and then centrifuge it. Because what we see is that the heavier red cells sink to the bottom. In this case, 44% of the volume is red cells. And the lighter plasma floats on top, in this case 55% of the volume. And in between the two, you just get a thin layer, 1% or less of white blood cells. So we can see that the blood contains lots of red blood cells, reasonable amount of plasma, but a relatively small proportion of the white blood cells. Now, erythro is from the Greek word erythros, which means red. So erythrocytes, as we've said, cytes are cells, so erythrocytes are the red cells. Erythropoietin is the substance, it's a hormone really, produced by the kidney, that stimulates the process of erythropoiesis in the bone marrow. Remember, erythropoiesis is the formation of the red cells in the bone marrow. And erythema just means a red area. That's not actually directly related to the blood, but I've put it in because it's another illustration of what we mean by erythro. And here we can see a partly spun sample with the plasma on top, the red cells. And if you look, there's just a thin layer of the white cells there, but I think we see that in the next slide. But the erythrocytes, as we can clearly see, are red. Now, the Greek word for white is leukos, and this is where we get leuco or leuc from. And this can be spelled L-E-U-C-O or L-E-U-K. So leukocytes are white blood cells. And if you can look where I've labelled the leukocytes there, the thin white line, you can actually see there is some white there. That's the layer of white cells in the centrifuged specimen. Now, leukocytosis would be a condition where there is an increase in the number of white cells. So, for example, if you had an infection, the white cells will increase in number to combat that infection and cause a leukocytosis. But conversely, if there were not enough white cells, because of bone marrow suppression, for example, there would be a leukopenia. So leukopenia is a deficiency of white cells that can lead to immunocompromise. Now, leukemia means literally white blood. And in leukemia, there is a malignant proliferation of the leukocytes. So when we look at a leukemic field, there are a lot more white blood cells than we would expect. Therefore, we call it relatively white blood leukemia. Although when you look at the blood, it still looks red, but that's what we call it. Leukodystrophy means degeneration of the white matter of the brain. Not directly related to the blood again, but it's an illustration of the word leuko. Now, cyto means cell. Cytic, cytosis, cyto always means to do with cells. And it comes from the Greek cytos, spelled K-Y-T-O-S, which means hollow, like a container. Because, of course, the ancient Greeks didn't discover cells. Cells weren't discovered until 1653 by the great English scientist Robert Hooke, who first published the drawings he made in the groundbreaking work Micrographia. So, and actually he named cells because he thought they looked like the cells that monks slept in, little cubicles that monks slept in. That's where we get the term cells from. But to maintain the classical condition, cytosis, now it just means to do with cells, but originally it meant a hollow space or container in the original Greek. So as we see, cytosis is commonly used as a suffix on the end of the word. And as we know, leukocytosis is an increase in the number of white cells. But a lymphocytosis is specifically an increase in the number of lymphocytes. And lymphocytes can be increased in number in viral infections, for example. Monocytosis is an increase in the number of monocytes particularly, as may occur in chronic bacterial infections such as tuberculosis. Thrombocytosis is an increase in the number of thrombocytes. So thrombocytopenia would be a deficiency in the number of thrombocytes. And these are the platelets which are essential for blood clotting, of course. And we check these when we do a full blood count. An FBC will give us a differential white cell count indicating the possible cause of a leukocytosis or a leukopenia. And the other example there, spherocytosis. Spherocytosis is a genetic disease where the cells become rounded, spherical, as opposed to the normal erythrocytes, which are the biconcaved discs. So still thinking about cytic, we can have microcytic, which means small cells. And as we saw, iron deficiency anemia is a microcytic anemia. Or there can be a macrocytic anemia, as can occur, for example, in pernicious anemia, which might be caused by a lack of vitamin B12. Normocytic would simply mean that the red cells, the erythrocytes, are of a normal size. And macro and micro are common terms that we use in a lot of medical vocabulary. Micro from the Greek mikros, meaning small. Macro from the Greek makros, meaning large. Now, penia is from the Greek for deficiency or poverty of. So a leukopenia means a reduction in the number of white cells in the blood. A neutropenia is a deficiency or a reduced number of neutrophils in the blood. And a thrombocytopenia will be a deficiency in the number of thrombocytes, that is the platelets in the blood. All these things are very important to know about clinically, of course. A leukopenia or a neutropenia will predispose to infection. A thrombocytopenia will predispose to bruising and hemorrhage and reduced blood clotting. Lysis is the Greek word for dissolution or breaking up. So lysis, lysis, that's where we get these words. So hemolysis or hemolysis is the breaking up of red blood cells. So hemolytic anemia would be an anemia which is caused by excessive hemolysis, as we might get if there's an abnormality of the red cells or an abnormality of the hemoglobin. Oma from the Greek means a lump or a swelling. So lymphoma is proliferation of lymphocytes, and that can lead to swellings of the lymph nodes, the spleen, and the bone marrow will also be congested with malignant lymphocytes. Myeloma is an increase in the number of plasma cells associated with malignancy. And the plasma cells are the antibody-making cells that develop from B lymphocytes. But in myeloma, these become malignant and greatly proliferate in number. So multiple myeloma would be a metastatic myeloma, where the plasma cells, the malignant plasma cells, can accumulate in areas such as the spine, the skull, the pelvis, and the ribs. Well, there's quite a few hundred other videos on the Campbell Teaching YouTube website. And also, if you want to get copies of the ebooks or order hard copies of the books or get copies of the videos in soft copy, you can get those from campbellteaching.co.uk.